gentlemen, thank you for joining us for the third symposium of the Rare Diseases Ghana Initiative. Rare Diseases Ghana Initiative is only 3 years old. This is its third symposium on birth defects, and the progress or the growth of rare diseases has been very phenomenal. The impact has been far-reaching, and we are grateful that we have all of you here to hear about rare diseases, birth defects, and what you can do to support persons living with rare diseases, what you can do to support the Rare Diseases Ghana Initiative to create more impact to people who actually need it. At this point, I would like to introduce the CEO and founder of the Rare Disease Ghana Initiative to give us his address. Mr. Samuel Ejewiafi is a psychologist, a clinical psychologist at the Ga East Municipal Hospital. He is also, as mentioned earlier, the Executive Director of Rare Diseases Ghana Initiative. Sami, over to you.
So I was talking about rare diseases and Rare Disease Ghana Initiative. Our organization has existed since 2017, but we formally registered it in 2018. And since then, we've been leading advocacy for persons living with rare diseases, undiagnosed and genetic. And we have been spearheading the advocacy since the time we registered. And so far, our organization has recorded more than 50 rare diseases in Ghana, and we are supporting over 50 families with different needs at different points. And our work has largely focused more on being able to connect patients to care, being able to bridge the gaps in access to care, which means really connecting them to access to healthcare and access to social care as well where needed. And so this being the third symposium, as I said earlier, we've previously had two, which is at Kolebu. We held the two at Kolebu Teaching Hospital. The first one was on rare disease and genomics. The second one was on rare disease and orphan drugs. And this is the third one we are having. The challenges with rare diseases have revolved around the lack of awareness, the lack of access to healthcare professionals, the lack of policy, the lack of services in terms of getting access, the delayed in diagnosis, and the fact that we do not have genetic testing services available in our country makes it very difficult for patients to access diagnosis. Where available, it is exponentially expensive, and most families cannot afford. The surgeries are very expensive. The cost of care is very, very expensive. And so it becomes very, very challenging if families need to receive care. And so our organization has made a commitment to ensure that patients are not left out in terms of healthcare delivery. And so we are very committed to the sustainable development goals and making sure no one is left behind. We are working strongly with different stakeholders, including the clinicians, the patients, organizations, the patient themselves. We are working with the government agencies and industry partners, as well as other nonprofit organizations and foundations to be able to deliver and ensure that we bridge these gaps. And so over the years, our organization has helped to train medical doctors through partnership with Femca Medicals. And we are hoping to expand. We are looking forward to expand this partnership to make it more a bigger one, where we can actually impact more healthcare professionals to have knowledge in rare diseases and be able to manage them when they have access to those patients. And then we are also into supporting the diagnostics of patients. We recently were able to diagnose a patient with Incase polysaccharidosis type 4, and we are currently working on helping to diagnose patients with cystic fibrosis somewhere in Komfo-Anokye Teaching Hospital, and some patients with suspected SMA. And we have a patient with Mukena-Albright syndrome that we are also helping to get a diagnosis. And so we work with laboratories across the world to be able to deliver this diagnosis through our charitable access program. And we work with, when it comes to the treatment, we recently the FDA published the regulation for the orphan drug access registration for orphan drugs in Ghana, which is something positive that we are very happy to have in a country here. And so we are hoping to work with the FDA in that capacity to also ensure that patients have access to the treatment. And so we are currently in consultation with some of the one of the pharmaceuticals, Biomarin, to have access to do the first enzyme replacement therapy for one of our patients who we recently diagnosed, the patient with MPS 4. And so our work has focused largely on education and engagement with stakeholders. We've done a lot of advocacy. We have a care coordination program where we support the patient. And so through the care coordination program, we've been able to support patients to access surgery. About 4 patients have benefited from surgery through our program. And our work is also to advance research. And so as an organization, we've currently built a registry for undiagnosed genetic and rare diseases. And we are looking forward to start rolling it out, to start collecting data on rare diseases in Ghana. And we've built that already. And so we have a meeting with the Ministry of Health to see how we will roll it up into a national program. And so we are very committed. There's a lot of work going on. If I want to talk about Rare Disease Ghana, we may not finish today. We've built 5 networks. Now we have the Ghana Professional Network, and anybody can join that network as long as you are a health professional. As long as you are a health professional, you can join our professional network for rare disorders. And then we have the patient network, which is called the Ghana Rare Family Network, which is also our network of professional patients who do not belong to any formalized organization or support group. And so we have built that network, and we currently have patients that are within that network. It's our support group for patients who do not yet have a support network in Ghana. And then we have the Genetic Alliance, which is a coalition, basically organizations and institutions that are implementing rare disease or advocating for rare diseases. So we have the patient groups, the organizations which have been formalized, as well as the support groups which have not yet to be formalized, all come together to be able to lead one advocacy in that regard. And then we have the corporate alliance, which is also our network of corporate institutions and foundations that are providing some support or have made commitments to support rare diseases. And so we have all of these in place. You can go to our website, www.rarediseaseghana.org, and you can find information on all of these networks. Regarding, people always ask me questions regarding financing of these whole big projects and all these big innovations that we have, and there's so because to ensure sustainability of the rare disease programs and initiatives in Ghana, we have also formally established the Undiagnosed and Rare Disease Trust Fund, which will be made available to patients to apply and other clinicians to apply, for them to be able to access healthcare. And so if a patient needs a diagnosis, they just have to apply, and the funds in the trust fund will be issued to cover the cost of getting the diagnosis, in the same way with the treatments, and in the same way with other needs that the patient may have. And so it's a special purpose fund that has been set aside. Hopefully in the course of the year, we would organize a gala to be able to deliver, or be able to raise some more funds into this trust fund. And so this is some of the things we've done. It's a lot of work, but we are always open for collaboration, and our collaborative areas is in the area of capacity building. And so anybody who wants to help us with training medical professionals and making sure that the healthcare system is well equipped and robust for providing care for rare diseases, can also contact us, and we will plan the capacity efforts together. And we're also into collaboration in developing appropriate public health policies for rare diseases in Ghana. And as I recommend that we are open to that collaboration as well. And we are also open to helping with surveillance of rare diseases in Ghana, undiagnosed genetic and rare diseases in Ghana. And so we are very open to collaboration in that regard. And we are also open to collaboration in helping to improve the diagnostics and access to therapies in Ghana. There's also an area we are very open to collaborate, and we are open to share knowledge and experiences and share data as well. And so we are very happy to learn from other organizations, as well as also organizations learn from us and be able to share resources where available. And so that's also another area we are open to collaborating. And then we are open to collaborating to facilitate the networking of health professionals and patient groups. And so that's also another area. So help making sure that the patient groups, we are building their communities, and we are empowering the communities, and they are very linked to their health systems and their healthcare professionals. And the relationship is going very well, and the patient is not left behind, is also an area that we are very committed. And so as an organization, our goal is to help get to the sustainable development goals by reducing poverty. If one patient who is affected by rare disease, if their family is affected by rare disease, automatically they are on a journey to the poverty line, because the cost is expensive, the care is expensive, and you may not be able to maintain a steady job as you spend all your time in the hospital moving around. And so it's a journey. So if we come in and we are able to help, we're able to reduce that. We are also looking at enhancing the good well-being and the quality of life of the people. And so helping to achieve sustainable development goals is also one of the things we are focused on. And then because rare disease affects children, they end up in schools. And so we need to also improve the educational system so that the children will also benefit from the educational system. So quality education is also something we look at. And gender equality, most of the care is left on the women, and I can attest to that fact that most of the people I engage with on a daily basis with regards to rare diseases have been largely the mothers. And so it's the conditions come to some extent disempower the women, and so we need to look at that as well and be able to strengthen and help the women. And then the other sustainable development goal that we are aiming at is to the development of new innovations, new industry, and new infrastructure. The focus on rare disease have led to new things coming in, new businesses, new ideas, new innovations. And so a focus on that area will help. And we are also looking at reducing inequality. And we can all attest that the rare disease community has been largely neglected. And so we want to be able to bring them closer to making sure that they are not left behind. And we are open to partnership. It's at rare disease level that you see a strong partnership going on between patients and their clinicians and their patient organizations and the industry. And so that has been a very successful model that has worked elsewhere. And we are also aiming to ensure that that partnership continues here in Ghana and in other parts of Africa where we are able to have access. And so it's a lot of work we've done. If I keep talking, I'll never finish. So I would want to end here, and I would want to encourage you to enjoy today's session. It's well planned, and the contents are suited, are well. We carefully selected the topics and the speakers, and we always, as we have always done, bring on the experience and people with rich knowledge to share. And so I believe that you are really, really going to enjoy this session, and all the best. Kindly reach out to us at Rare Disease Ghana Initiative through our email info@rarediseaseghana.org, or you can call us, just check us on any of the social media platforms, and we'll be very, very happy to collaborate with you. And so thank you very much. Our mission is to improve the well-being and the quality of life. That is all we stand for. Anything that will enhance the life of somebody living with rare diseases, we are very, very happy to support that. Thank you very much for your time, and I do appreciate this.